Welcome to today's session entitled Supporting Age-Friendly Efforts at the State Regional Level. Before we get started, I'd like to go over a few items so you know how to participate in today's event. When you joined today's webinar, you selected to join either by phone call or computer audio. If for any reason you'd like to change your selection, you can do so by accessing your audio pane in your control panel. You will have the opportunity to submit text questions to today's presenters by typing your questions into the questions pane of the control panel. You may send in your questions at any time. We will collect these and address them during the Q&A session at the end of today's presentation. And now I'd like to introduce Jeanne Anthony, consultant with Grantmakers and Aging and moderator for today's webinar. Jeanne?
Thank you, Tracy. I'm delighted that so many of you have joined us today. Grantmakers and Aging is beginning a series of webinars designed to encourage greater philanthropic engagement in age-friendly efforts across the country. The objective of the series is to bring attention to topics and issues that relate to age-friendly community efforts and the challenges they face. While age-friendly efforts need to be grounded at the local level, there are opportunities to improve the success of these efforts by working at the state and regional level to remove obstacles and to address policy constraints. Today, we will be learning about two age-friendly initiatives underway in New Hampshire and Massachusetts. With us are Kelly Laflamme, Program Director at the Endowment for Health in Concord, New Hampshire, and James Fuccione, Senior Director at the Massachusetts Healthy Aging Collaborative. Welcome to you both. As Tracy mentioned, you can enter your questions for Kelly and James at any time in the question box on the right side of your screen. I will read the questions to them during the question and answer portion. Kelly, let's begin with you. New Hampshire's diverse stakeholders in aging issues have come together to redefine aging through a collective impact process, which hinges on the idea of building a shared vision to create age-friendly communities through collaborative efforts across the state. Kelly, thank you for sharing information about this collaborative.
Thanks, Jeanne, and thanks to Grantmakers and Aging for the opportunity to talk about the work the Endowment for Health is involved in to make New Hampshire a great place to not only grow up, but also to grow older. So next slide, please. For those of you who don't know the Endowment for Health, we're a statewide health foundation in New Hampshire. And our mission is to improve the health and reduce the burden of illness for the people of New Hampshire, especially the vulnerable and underserved. Next slide, please. And our work cuts across the lifespan. We seek to co-create communities that support the physical, social, mental well-being of all people at every stage of life. And so we have 4 population-focused initiatives that are targeted to early childhood, health equity, children's behavioral health, and elder health. And our vision for all people is good health and realized potential. Next slide, please. So as a foundation, in 2013, we assessed our strengths and our value added to achieving our vision. And we developed a new strategic plan that really flipped the way we do our work away from the traditional philanthropic approach of funding direct services that direct people-level impact to something called field building, which really works to create systems change that then in turn creates people-level impact. Our stakeholders told us in our planning process that our biggest strengths are shining the light on issues, especially ones others don't want to talk about, and bringing people together to work on tough, complex social issues. And so we thought about it. I mean, our grant-making budget is just under $2.5 million. And when you look at the state's Medicaid budget, that's a rounding error. And so what's the highest and best use of our limited grant dollars and our limited people time? And so that's when we decided that field building was the way to go. Next slide, please. As we found our sweet spot as a philanthropy in field building, we realized that the broader nonprofit sector talks about this as collective impact. And I'm sure many of you already know there's a body of literature out there on collective impact, but the core concepts are bring together people from different sectors, agree to a specific social problem, agree to solve it, use a common agenda based on a common understanding of challenges and opportunities, align your efforts, and then use common measures of success. And so that's what we set out to do. Next slide, please. But before I dive into our approach, I thought it would be important to share with you why the Endowment for Health are doing this work. And during our strategic planning, all we had to do was show our board this one slide, how population change is happening in New Hampshire, and they got it. As a state, we are living longer, and we're staying healthier longer. So we are enjoying longevity. But that longevity creates change in our populations that demand us to create change in our communities. And that kind of change demands a organized collective approach at the state and local level. Next slide, please. So creating good places to grow up and grow older takes working across boundaries. And I've heard this type of collaboration called an unnatural act, that collaboration is an unnatural act. But we have to do it. We have to find ways to work across culture, across geographic regions, across sectors, across the vast array of issues facing our communities. Previously, the conversation around aging in New Hampshire focused exclusively on the healthcare budget over at DHHS. We weren't talking about how do we change our communities to be age-friendly. Next slide, please. So how are we doing it here in New Hampshire? Well, first of all, as an organization, the Endowment for Health was a total newcomer to the issues of aging in New Hampshire. We had dabbled on the edges of aging, but we weren't really considered experts in the field. So we began by rooting ourselves in nearly 2 years of work to engage stakeholders from many disciplines and from across the state. And out of that work, the New Hampshire Alliance for Healthy Aging was born. It was launched in 2016 to advance a shared agenda in support of a shared vision. And our theory to create this change is if we can change the conversation and change policy and change practice, we'll create age-friendly communities that support older adults and their families and advance health, dignity, and independence for all. Next slide, please. And I just wanted to share with you a timeline of how we accomplished this work, as other funders thought you might be interested. First, recognizing our newness to the field, we formed a core advisory group, essentially the usual suspects, the people that were known and trusted in the field of aging. And we consulted them every step of the way as we started out, sort of paying homage to the people that really have been working in the field for a very long time. After our initial conversations in 2014 with those core people and about 30 to 40 other stakeholders, we created a shared vision for the field. And I'll get to the details about that in a minute. Then we contracted with the University of New Hampshire Center on Aging and Community Living to lead us and our stakeholders through an action planning process. And over the course of several months and under the facilitation from the Center on Aging and Community Living, we co-created an action plan to realize our vision. And so to implement collective impact, we knew we needed to identify a backbone organization, and we saw this work UNH was doing as a way to test drive their capacity to serve in the future as a backbone organization. We also knew that in order to truly be collective impact, we needed to develop leadership, a steering committee to guide not only planning, but the implementation of a plan. And so to make sure that that work moved across that dotted line from being led by the endowment to being supported by the Endowment for Health, that this was more than just the endowment's initiative. This is a social change initiative for the state of New Hampshire. And that's how it went. In early 2016, we transitioned from being funder-led to being funder-supported. Next slide, please. So what do we mean in New Hampshire when we say age-friendly communities? Well, our more than 40 stakeholders from across New Hampshire came together to create this shared vision. We believe that age-friendly communities are places where, number one, in the orange quadrant, fundamental needs of food, shelter, and safety are met. Next, in blue, a broad range of living options are available to support us at every stage of our aging process. And this requires attention to planning and zoning, attention to affordability, and supports to help people live and age where they choose. Thirdly, in the teal piece, our families and caregivers are supported so they can support us through our aging and dying processes. And this becomes increasingly important as more and more of us choose to age at home. Fourth, social and civic engagement options are plentiful and appropriate for all stages of aging and for all cultures. So this means social engagement, volunteer, extending our time in the paid workforce. Fifth, quality physical and mental well-being supports are in place to promote healthy aging and prevent untimely decline, to address health issues that occur as we age, and to support elders and their families through the end-of-life processes. And then finally, our stakeholders believe that age-friendly communities require a strong and effective advocacy capacity to advance this vision. So you might be thinking, that looks a little bit like the AARP or WHO model of age-friendly. So remember when I said earlier we were complete newcomers to the field? We created this diagram to summarize our conversations with our stakeholders before we had actually heard about age-friendly communities. And so, you know, our model is very similar to, but slightly different from the WHO model. Next slide, please. So realizing that our vision isn't going to be easy and that collective impact approach is the best way to work, we created a roadmap, our process for change, and it includes 3 key steps. First, to change the conversation about aging across all sectors. Second, to change public policy to promote a strong, stable infrastructure for aging. And third, to change practice across sectors to improve care and support for older adults, our families, and our communities. Next slide, please. So this chart I know is very busy and has a lot of words and information, but basically I just wanted to share with you our chart for how we do this work. So on the left side, you'll see that we have the program team, which is the staffing of the backbone organization, and myself. And then we also have a steering committee, which is a volunteer body of 16 individuals from organizations across the state. On the right side, you'll see we have stakeholders that have organized themselves in work groups that cut across our strategic priority issues and also allow us capacity to do backbone capacity like communications and measurement and advocacy. And just in case you're wondering, for our paid staff, we have approximately 2 full-time people that are shared, the workload being shared across 3 individuals. Next slide, please. So this too is a busy diagram, but what it does is it shows how our strategic priorities align with our theory of change to change the conversation, change policy, and change practice, and our shared vision, which is down the right-hand column in the colored rectangles. And so I was going to do a deep dive into 2 of these areas. So next slide, please. So advocacy, if you go back one more to advocacy. In our advocacy work, we did not have an existing coordinating organization that could lead us on advocacy. And so last year, we supported a grant to New Hampshire Legal Assistance to add to their capacity to bring together an elder health policy table. They worked with advocates at this table to identify short-term policy priorities for 2017, and they are currently working to develop a long-term strategic policy plan for the next 3 to 5 years. And while there have been numerous elder advocates working very hard for many years in New Hampshire, this was the first time that a comprehensive table was convened and came to agreement on a shared advocacy agenda. And as I said to one of the longstanding advocates, you know what your advocacy agenda is, but what's your shared advocacy agenda with the rest of the people around this table? And that's the work that they've done over the last year, and they've had some policy wins because of it. One of those policy wins was an increasement in the reimbursement rate for direct care workforce and the establishment of a commission on the direct care workforce for people with dementia and Alzheimer's. The next one I wanted to dive a little bit deeper on is our caregiving work group. So one of the things we all know is that family caregivers don't often self-identify as caregivers. And because they don't get access to the supports that could help them when they're that could help them before they reach a crisis state. And so one task that the caregiving group has worked on is the development of a flyer, which is really a self-identification tool. It asks a series of questions, and if you answer those questions with a yes, you're a caregiver. And here's the phone number you can call to get the information that can help you. The second thing the group is working on is helping to develop tools and training for employers so that they can be supportive to the people who work for them that are juggling work and family life as a caregiver. New Hampshire is heading towards a workforce crisis. Our strong economy has driven unemployment to historic lows, and employers need to know how they can retain caregivers in their workforce. And as you know, that's a win for caregivers as well. Next slide, please. So I also wanted to share with you a few other investments that we've made as a foundation that complement this collective impact approach of the Alliance for Healthy Aging. As a foundation, we have made an investment to underwrite a full-time reporter that is focused on the issues of aging in New Hampshire. And our approach to this was to require that reporter to study and utilize a solutions journalism approach to their work. And the entire Union Leader newsroom was also invited to participate in this training. So solutions journalism is a form of journalism that goes beyond sounding the alarm that there are problems in a community to dig down and find out where the solutions are, whether those solutions are local, statewide, national, or even international. The paper becomes a platform for helping to solve critical social problems. And so in the past year, the results have been great. Nearly weekly solutions-focused articles have appeared in New Hampshire's most widely disseminated newspaper. And other papers are picking them up. There's no paywall that people have to cross in order to read them because of our funding. And the reporter, Gretchen Grosky, is a sought-after expert who has immersed herself in all issues aging. And at the GIA conference next month, you'll have the opportunity to participate in a deep dive session on this strategy. Next slide, please. The Endowment for Health has also been very honored to be part of funding the national work to reframe aging, and we will be part of a regional rollout in northern New England to build local capacity to change the dialogue on aging in our region. Next slide, please. Along the same lines, partnering with other funders, we have created the Tri-State Learning Collaborative on Aging, working with Maine, Vermont, and here in New Hampshire. So for people who live and work in our 3 states who care about creating a more age-friendly region, through the Tri-State Learning Collaborative, we can offer free membership, a robust website with many examples of age-friendly communities. We have a monthly webinar series that's free. And we also have a community leaders forum and regional events. In our planning process, we realized that the learning agenda of New Hampshire is the learning agenda of the region. And so we decided, why go it alone? Why not work together? And the results of that have been really amazing. So that's the story from here in New Hampshire. And now I'll pass it back to Jeanne.
Kelly, thank you so much. That was just an absolutely amazing presentation. And I'm really just so excited to hear about some of the work that you're doing. And I know we're saving question and answer until the end of James's presentation, but I know I have a couple about some of the work that you're doing, and we'll look forward to the presentation at the GIA conference coming up. But boy, that solutions journalism is a new feature for me, and certainly one that I think a lot of organizations could stand to learn more about, because I'm convinced that it will make a huge impact on how people think about solutions and just about aging in general, and really combines with the reframing aging very well. So thank you so much.
You're welcome. Thank you.
Yep. So next we'll hear from James Fuccione. The Massachusetts Healthy Aging Collaborative is a network of leaders in community health and wellness, government advocacy, research, business, education, and philanthropy who have come together to advance healthy aging. James, tell us more about the work that's happening in Massachusetts. So I think we're having a little bit of a problem. Is James with us? Maybe a little technical problem? James, are you there?
James, let's have you go up to your audio and then reselect the phone call and try dialing it again.
So while James is trying to redial in, maybe I could take the time to ask a question of Kelly so that we're just not sitting here. One of the things that, oh, James, are you with us?
Yep, I'm back. Sorry about that.
Okay, great. Well, I don't know if you heard all the lovely things I said about you for the introduction, but the microphone is now yours.
All right. Well, I don't believe it. You might have to say it again later, but I'll trust you now. So thank you all again for, and I only say again because I was muting myself and having technical difficulties. But thank you to Grantmakers and Aging, and thank you to everyone for joining the webinar. So next slide, please. Just to quickly show a timeline of kind of the evolution of the Massachusetts Healthy Aging Collaborative. I'm sure people are generally aware of the age-friendly movement from the World Health Organization to ARP, and then the advancement of dementia-friendly along sort of the international, national scene. But for our state, the Tufts Health Plan Foundation really was the spark for beginning a healthy aging movement in Massachusetts. And the Healthy Aging Collaborative began as sort of a convener and a steering committee for people to network, share advocacy points, to look at data and decide kind of what are the most important things that we want to focus on in our state. The past year, before January of 2017, was a strategic planning process that has brought us to the current state of the Mass Healthy Aging Collaborative being an action-oriented group focused on age-friendly and now dementia-friendly communities, working with dementia-friendly Massachusetts, as you can see on the timeline just before the collaborative came to its action-oriented state. Next slide, please. So what is the collaborative? And the collaborative is essentially a network of stakeholders that have come together, a broad-based set of stakeholders have come together to advance healthy aging. And again, the centerpiece of the strategy is advancing age and dementia-friendly communities. And we have three focus areas under that. One is, of course, building capacity of local communities to take those steps towards take that steps on the age-friendly designation journey, but also creating champions among the usual and unusual suspects, raising awareness, and initiating behavior change among policymakers and planners to use an age-friendly lens. So we have subcommittees on each of those three areas, and we actually just added a fourth subcommittee to focus on access, equity, and cultural inclusion. Those groups make recommendations to our 25-member executive committee, and we also have an advisory council of more than 100 organizations and growing that help advise kind of a broader set of strategy points for us. Next slide, please. And so in terms of our strategic framework, our vision is to better Massachusetts is an emerging national leader in vibrant age-friendly communities with a focus on older adults, and we've since added those living with dementia. And you can see our mission, but the approaches are sort of what I want to focus on here. And I just mentioned a fourth subcommittee on access, equity, and cultural inclusion, but you can see the approach on promoting equity with a specific focus on vulnerable populations. We're broadening that out and kind of the scope of that group to focus on ability level, income level, and also diversity of settings. So if you are homebound and getting home health services, if you live in an assisted living facility, if you live in skilled nursing, how can an age-friendly community still benefit those folks who are in the community but may have a tougher time accessing certain things. So, for instance, one thing that we focused on in my last organization that I worked for was helping people that were homebound with voting in local, and state, national elections, just as a point of kind of being a part of the community. We're also looking at enhancing our intergenerational policies and programming, ensuring we're engaging cross-sector actors at both the state and local level, so all city and town departments, all executive offices in the governor's administration and legislators and so on. And we have a mission to be accountable to measurable results, which is part of the challenge, given that every community, every city and town is different, but we are exploring that as we speak. So next slide, please. So when we presented the strategic framework back in January, it was very exciting to folks, but I think people saw it as a little bit daunting and how we would go about getting all of this done. So I'm going to talk about how we've simplified our approach when we're engaging our partners and potential partners. And I want to talk about the progress that we've made relative to our strategy. So in other words, instead of sharing the vision that was laid out in January, I like to kind of share the current state. And also because what Kelly shared from New Hampshire is really in line with what we're doing in terms of collective impact and all the other strategies that, or most of the other strategies that she mentioned. So next slide, please. So first of all, we're going back to the age-friendly flower that we all know and love, and just how we simplified this, sort of like AARP has split up the 8 domains. We've simplified it just to make it a little more manageable for the folks that we're engaging. So we've broken it down to 3 areas. We've boiled it down to physical environment, community and health services, and inclusion engagement. And by making these categories a little more broad, we found that we can more easily fit in other areas of concern. So you don't have to stretch the 8 domains as much. You can focus on other things. And just, for example, we've added social isolation, of course, our work with Dementia Friendly Massachusetts, access to healthy food, public safety and consumer protection, and as Kelly mentioned, the caring workforce is a big concern in our state as well. Next slide, please. And also when we're encouraging communities to convene a task force or local action group as its first step, and you're wondering, if they're wondering about who should we have at the table, we tell people to focus on the social determinants of health. So in any community, you might have people to focus on housing and transportation, walkability, access to healthy foods, and so on. But just the value of getting these folks into a room, sitting across a table and sharing what they're doing to kind of cut down on redundancies and just to see how they could partner and work together on a basic level and kind of cut down on kind of extra movement. There's extreme value in that, and also the fact that this isn't on the slide deck, but something that we put up is from countyhealthrankings.org, and I'm sure many have seen these stats, but the fact that what determines a population health, countyhealthrankings.org said only about 20% is attributed to clinical care. So for all of the great medical and clinical institutions we have in Massachusetts, the way in which we get communities excited about this is that we say that about 80% of that pie is about healthy behaviors, physical environment, meaningful social relationships, and those are all things that communities can impact and influence. So we try to make the connection to social determinants whenever possible. Next slide, please. And just like New Hampshire, we have our own map, and with New Hampshire's trees and mountains were the base state, so I guess we did ours blue, and the dark blue communities are those with 30% or more of their population being 60 plus. So the Berkshires and Cape Cod, traditionally where a lot of folks go to retire, and thought of as the older parts of the state, but they're going to be joined by most other parts of the state in less than 20 years. And also Berkshire County in the western part and Barnstable County that represents Cape Cod are also two of the three counties in the state that are losing population. So it's also a consideration that we're looking at. So next slide, please. So in terms of our progress on the focus areas that I mentioned at the beginning, in terms of influencing policymakers and planners to use the age-friendly lens and adopt specific asks. So our governor, Charlie Baker, turned 60 right before his State of the Commonwealth speech, and he mentioned that in his conversations with folks across Massachusetts as he crisscrosses the state, and kind of he conveyed the idea that retirement age and what we think of as being older kind of is a thing of the past, and we really need to reframe our thinking. And he actually said reframing, which was great. But in that, he announced the council to address older adults in Massachusetts. So that's a 25 member council that are going to make a set of specific recommendations. They also held their first expert panel, and the collaborative was able to organize with our Executive Office of Elder Affairs a panel on age-friendly communities. So that was a really
James, this is Tracy. I believe we've lost you again. If you can try dialing back in.
Tracy, this is Jeanne. How are we doing with James? Should I initiate some questions while we're waiting?
Let's go to the question box, and James will get you to call back in. Thank you.
Okay. So Kelly, one of the questions that has come in is about a concern that sometimes the effort begins from grassroots, and it sounded to some of the audience as if there were already groups in place to undertake some of these initiatives. So maybe going back a little further in sort of New Hampshire history around age friendly, I know you said that the endowment wasn't actually working on aging issues. So how did you connect to aging issues? Was there a grassroots initiative underway? And was there sort of a simultaneous recognition on the part of the endowment that aging was something you wanted to undertake?
Yeah, I can take that question, but I see James is green again. Do you want to stick with my question or go back to James?
Why don't we answer the question and then we'll go back to James.
So as I said, when we set out to do the work, we went to some of the key leaders that were known in the field, both as experts, like a doctor up at Dartmouth, and service providers from the CAP agencies, as well as longstanding elder health advocates. And so we started by talking with those individuals and by bringing together a stakeholder group of more than 40 people that included, grassroots level folks, consumers, as well as policy people and service providers. And so we really set out to try to build the biggest tent possible and to come up with collective solutions together. And you're absolutely right. There's lots of great local work to build upon, and there's constantly new local work being generated from volunteer driver programs and other very grassroots level efforts. And we just try to knit it all together under the tent of the Alliance for Healthy Aging. And, one of the things, we try to emphasize, and I know we talked about earlier with James, that this isn't necessarily about creating new projects, but really finding the way to mutually reinforce each other's existing work and just direct it in the same direction toward shared goals.
Great. Thanks, Kelly, for that answer to that question. And James, if you're back on, maybe we were on progress on focus areas, and you were talking about accomplishments and activities, recognizing your governor had just turned 60 years old. Do you want to pick up right there?
Right. Thanks. And sorry again, everybody. I'm just really going the extra mile to prove that age-friendly doesn't come without technical difficulties. So sorry about all that. So yes, our governor turned 60 and announced the Governor's Council to Address Aging in Massachusetts. That council is going to make recommendations on policies and actions to our state legislature and down to the executive offices. And one thing that we've been able to do as a collaborative with our Executive Office of Elder Affairs is the first expert panel that the Governor's Council heard was an age-friendly panel presentation. And also our testimony included kind of reframing a Baker administration initiative called the Community Compact Agreements. So this very quickly is a two-way agreement between the Baker administration and cities and towns so that the administration can help cities and towns with best practices. And what we're trying to do is add age and dementia friendly as a best practice in the Community Compact Agreements that any municipality can sign with the governor's administration. So a work in progress, but we do have some interest and hopefully we'll be hearing something on that soon. Other areas of the state that we've made progress is that our Department of Public Health made a revision to their determination of needs guidelines. So now that any healthcare facility overseen by DPH that adds services or makes capital improvements has to contribute a certain small percentage of funding to a healthy aging statewide fund. We're not expecting it to be significant, but it's still a sign of progress in this area, recognition of an aging population, and is exciting for our part, the state's support of communities. And also, our Attorney General's office is revising the community benefits guidelines. So our Attorney General sets expectations on how nonprofit hospitals and HMOs should develop and report on benefits and programs they provide to the public as part of their commitment to the communities they serve. So we're also trying to encourage the Attorney General's office to highlight age and dementia friendly efforts. Next slide, please. In terms of creating champions, I lost a little time with my own technical difficulties, so I'll mention that our alignment with Dementia Friendly Massachusetts has really been the major step in this area, and the fact that we've become champions for Dementia Friendly, and Dementia Friendly has become champions for Age Friendly. And so now, between myself, a dedicated staff person at ARP Massachusetts, Valerie Spain, and also Emily Kearns from Dementia Friendly Massachusetts, we coordinate our efforts, we share contacts, where we're going, who we've been seeing, and all kinds of leads so that we are aligning and promoting dementia friendly and alongside age friendly. We're also very quickly creating champions through membership to the collaborative. So we've had an open invitation to any and all to join our advisory council and other various subgroups. But now what we're doing is we're creating sort of a membership document where we have our own two-way agreement that shows how the collaborative supports age-friendly, whether you're a city or town, whether you're a service provider, a community-based organization, a business, or what have you. And then in return, that entity sort of takes a look at its mission and goals through an age-friendly lens. So if anybody's familiar with the 100 Million Healthier Lives campaign from IHI, a lot of organizations are taking a look at their own mission through that context to see how they can see what they do through that lens. And that's exactly what we're trying to do to get folks to think about how they overlap and intersect with age-friendly communities. We also have two of the leaders of the age-friendly university movement in our state, UMass Boston and LaSalle College. So we've been thinking about our partnership with those institutions and other various colleges and universities. And also planning agencies have been huge, and they've really stepped up to convene cities and towns and to really help with the planning side and physical environment side of age and dementia friendly. Next slide, please. And then in terms of building capacity, I mentioned Better Together. It's a report from ARP that compares age and dementia friendly processes of continuous improvement. But also when we show folks the 8 domains and then say, well, there's 10 sectors to dementia friendly, this report's really been our playbook to line those up and to show people that age and dementia friendly are better together, better done, from the outset. And then in terms of the Mass Municipal Association, the Trade Association for Cities and Towns, they're going to be including age and dementia friendly as part of their best practice series. It's an annual resource they put out to their members. And also data has been the key. And the Healthy Aging Collaborative through Tufts Health Plan Foundation worked with UMass Boston to create a healthy aging data report. So we have a healthy aging community profile on all 351 cities and towns in the state. So it's from 2015, but we're still pushing it as a conversation starter. It's still great data, and it's still much appreciated, and is in line with a lot of the assessments that we're seeing too. So next slide, please. In terms of challenges and considerations, kind of carving out a legislative agenda has been one of our challenges in kind of the policy and planning area, just because we have a 2-year legislative session with a full-time legislature that files between 6,000 and 8,000 bills per year. We've done an analysis with AARP Mass and found that 440 bills have something to do directly with older adults, and that doesn't even include housing, transportation, all kinds of other issues, as well as a huge zoning reform campaign that's going on in the state right now. So we're looking at sort of a filter that uses the 8 domains as a guide to see what we could and should support. In terms of creating champions, we think the MPAC membership will help us bring in the unusual suspects once we have some examples of people that see their mission through an age-friendly lens. We think that'll be extremely helpful. In terms of building capacity, the business case for age and dementia friendly is sort of in development right now, but that's been a challenge to line up what exactly that would mean. Tufts Health Plan Foundation is supporting an age-friendly employer program, and dementia friendly has a dementia friendly business designation. So we're kind of exploring a combination of all of those things to see what we can put together for one campaign. And then, of course, sustainability for our statewide collaborative and for local communities. Tufts Health Plan Foundation has, as I said, been the pivotal kind of spark in this movement, and ARP is stepping up increasingly with support. But as much as philanthropy is the key to what we're doing, we realize that this work has to be the work of communities and not philanthropy eventually. So we're kind of exploring the long-range sustainability options for our strategy. Another kind of hidden challenge is there's no county government structure in Massachusetts. You have kind of different things in different counties. So Barnstable County on Cape Cod has a health and human services entity, but they're the only one in the state with that. So it's a challenge kind of carving out regions and getting people to kind of work across borders to collaborate in any organized way, because you have these sort of shadow regions like Metro West or the Merrimack Valley that really don't have a specific border like counties do. But we are working our way through that and creating more and more learning communities in this state. Next slide, please. And I mentioned this before very briefly, but one thing we're trying to do in our reframing is reframing the state funding options as age and dementia friendly. So whether it's community development block grants, senior farmers market nutrition program, or Complete Streets program, we're saying, just like we say to cities and towns that they are doing something age friendly already, they're just really not calling it age or dementia friendly. We're saying the same thing to the state. And these initiatives alone, and this is and not the exhaustive list, but these initiatives alone represent hundreds of millions of dollars in state support for housing and access to healthy foods and infrastructure and so on and so forth. So that's one way we're trying to get people to open up their thinking to realize that age-friendly, dementia-friendly is already really being supported on a grander scale. So next slide, please. And then in terms of our current state, we have a map on our website to show the activity. We have 21 active communities that are age-friendly, nearly 60 emerging age-friendly communities, and then about 20 dementia-friendly communities with many more of those emerging as well. And not shown here, but we have other sort of icons on this map, including more than 60 purple coffee cups to signify all the memory pathways going on across the state. And one of our ways of tracking and showing the activity that we're engaged in. Next slide, please. And then just a quick thank you, and then these are kind of the reports and resources that we offer to most people in the Tough Health Plan Foundation and UMass Boston just came out with an age and dementia-friendly Commonwealth scan that focuses on dementia and resources that people living with dementia and their families can access. So with that, I'll turn it back to the organizers, and thank you all very much.
James, thank you very much. And I'm sorry about the technical difficulties, but I think we were able to weather them very well and to get through the presentation to hear the exciting work that's going on in Massachusetts. Since I already asked Kelly a question, I have one for you. And it really focuses on the dementia-friendly integration that you're bringing to the age-friendly work. You know, most people, I think, understand that the age-friendly network has been around since about 2012, and that the dementia-friendly work that started in Minnesota was really brought to the nation through the White House Conference on Aging a couple of years ago. But in my experience, some of the communities that are undertaking age-friendly work around the country have really positioned the work as being for people of all ages, because they have received a little, I guess, pushback or concern from folks about the focus only on the older population. And so in order to gain broader support, they've created it as, you know, an effort for all ages. Bringing dementia-friendly into it, while not everyone is older who has dementia. Have you had any experience with that, and what have been some of the approaches that you've been able to take to facilitate that integration into the work, which is very natural, but I'm just wondering how you've addressed those kinds of comments or concerns?
Sure, absolutely. So, I mean, the Better Together report from AARP really, you know, says it all with one line, in the fact that a dementia-friendly community is age-friendly, but an age-friendly community is not necessarily dementia-friendly. So it really takes that extra added focus on dementia to bring that to the table, and to make sure that communities have that sense of awareness, whether it's first responders or banks and businesses, you know, to know how to be more patient and more compassionate with people living with dementia. And in terms of all ages, you know, we have plenty of communities that aren't calling it age-friendly. We have Salem for all ages. We have Livable Dedham. We really encourage communities to call the movement whatever they want, as long as they're engaged in the continuous improvement process. And, you know, we're always trying to push the idea that what's good for those what's good for older adults is good for younger adults. It's good for parents with children. Pushing strollers is as good with you know, people in wheelchairs that have limited kind of mobility and that kind of thing. You know, we've taken examples of that from around the country, and I think people seem to get it. And it comes up, you know, when you see communities that kind of battle at town meeting every year between what are we supporting and what are we funding? Is it schools, or is it a senior center or council on aging? And when you have these community-focused, broad-based kind of task forces that convene and hopefully include people representing all ages, it really heads off those discussions and gets the community to support what's the best thing for people of all ages in that community.
Great, that's very helpful. Thank you. So, Kelly, one of the questions that came up was concerning collective impact, and that's a process that's really designed to ensure social change occurs, but it's a little bit different from how people are accustomed to working. So talk to us a little bit about how that's been embraced in New Hampshire, and how have people responded to this different approach towards social change, and do you feel it's pretty well embedded now in all the work between you and the other folks within the collaborative?
Thanks for the question. So one of the things that predated our collective impact approach was the statewide United Way had brought in some collective impact training, and many nonprofits around the state became aware of the process. And so predating our work, there was already an awareness of that work, and the healthy living, healthy eating, active living field was very much using a collective impact approach. And then when we set out to do our work after the first year of sort of fact finding and listening, we did a collective impact training for our stakeholder group and sort of put it out there, and then said to them, are you willing to do this approach with us? Are not sort of imposing this approach, but offering this approach? And they responded really well, because they saw that trying to do things individually wasn't really working. They'd been doing it that way for a long time and it wasn't working. And knowing how we needed to work across sector, across unusual relationships, that it really was an approach that would work. So that part came, I think, pretty easily. But I think your question really gets at, all right, then how do you operationalize it, and how do people begin to act differently? And I think that we continue to work through it. And I think about advocacy, for example. We're still in the process of figuring out what happens when one of the key members at the advocacy table sees one of the bills that's being proposed by the group, sees that bill or that piece of legislation as a way that would actually be detrimental to the organization. And so does the advocacy group only advance things that everybody is 100% in agreement of, or not? And so, like right now, this, right in this season, our advocates are figuring out what's the best way to address that. The other thing I think the group has struggled with, and myself included, is how do we do things mutually reinforcing in a way that doesn't step on each other's toes? How do we work collaboratively and figure out the way to get the work done and not feel threatened by new actors in the field? And so, these are things that we're working out, and that's why it's really important to support that backbone support that can have many conversations with the stakeholders and check assumptions, check in on conversations, and just keep things moving forward, in a good way.
Great, thank you. And that actually, your mention of the backbone organization really brings me to another question. And maybe James, you can take a crack at this, and then Kelly, you can offer some thoughts as well. Frequently, the conversation is around how do we sustain this effort? And sometimes we talk about developing a business case or helping different organizations, some for-profit and some not-for-profit, understanding what the economic piece of this is. Does that fit into some of the work that you're doing at this broader level, the state and regional level? Kelly, you mentioned the low unemployment, but the need for opportunities. So how do you think about sort of the economic drivers or business case around the issue of sustainability for age-friendly efforts within your areas?
So, I mean, what I would say is we have our report on the longevity economy, but we have a lot of data from UMass Boston on sort of, the economic standing of older adults. And, because of the high cost of housing, there really is concern about people being able to remain in their own homes and sort of the ripple effect that has. So that's sort of one consideration, but also a national and state trend is, the growth in the job market for direct care workers, especially home care aides, nurses, and things of that nature. So there's certainly a case to be made there. The value of older workers is something that we're pushing. We don't really have it all gelled together quite yet, but there are plenty of points in terms of how a more walkable community, benefits local economy and all kinds of things like that. It's really just about getting all the steps together and putting it in a business case. But it's all the information's there. I think it's just a matter of collecting and packaging. We are certainly working on that.
Great, thank you. Kelly, did you have some thoughts you wanted to share on this one?
Yeah, so thinking about sustainability is really important, and our foundation made a commitment to do this work for the duration of our 5-year plan, and we are now going into a new planning phase and see no indication from our board that they're going to stray from continuing to do this work for another 5 years. But it is a challenge when you need to recruit other foundations to support the work, because a backbone organization is a significant financial investment. And so I think that that's a really good point of how do you make a case to other organizations to invest in this work, because there's no sense building out something that's going to die on the vine. And this is a long-term proposition to change our communities and change our culture to be age-friendly. And then I would just add regarding sort of the economic forces that are at play. I think that we've been working with our partners to really broaden the conversation about what aging in New Hampshire really means, and to not get ourselves limited by the issues of people who are vulnerable, not to ignore them, because certainly that's a really key issue, but to remind ourselves that our aging population, our entire population, but especially those who are older adults, are diverse in many ways and contribute in many different ways. And so how do we tap that energy and that momentum to keep New Hampshire going strong?
Absolutely, I think that's a key issue, and one that we haven't completely been able to resolve, how folks view the older population, and to put them in a more positive and contributory light, and an integral part of society, as opposed to perhaps something different. So we're fast getting close to the end of our time, and I just wanted to ask if there was anything else, Kelly or James, that you'd like to add before we close out this webinar today.
So this is Kelly. I'll just say, I think that we here at the Endowment for Health and in New Hampshire, we're on a learning curve of how to do this work and how to be a different kind of philanthropy than we used to be. And it's really been a rewarding experience working with our partners, and really just invite conversation from other foundations that are doing similar work, because to steal from something James said earlier, we're definitely better together.
Absolutely. Thank you. James, did you have any other thoughts that you'd like to add?
I was just going to say, to that point, I know that I'm going to be beginning work with New Hampshire and also Rhode Island and their age-friendly efforts, because we know that some people cross the border, the state border, for services and for certain opportunities. So we want to make sure that these age-friendly efforts don't stop at the state lines. They kind of go over them, and we're looking at collaborating to figure out how we can do that. So Kelly congrats on everything that you're doing in New Hampshire, and look forward to working with you and the other states that we border to.
Likewise, thank you.
Yeah, I think that's a really important point, and I think it's a great point to end on. I know that frequently when we're in regional areas or different areas that we tend to be competitive with one another because, you know, we're looking to draw tourists or residents or businesses or things. But in the instance of this type of work, you know, you said it right, Kelly, that we really are better together, and we need to put aside the competition and be more collaborative. So again, let me say thank you to Kelly and to James for their participation in today's program. We know that all the work that you're doing is really improving the lives of older adults and people of all ages in your communities and your states. For those of you that attended, thank you very much for participating and attending. We'll be making this presentation available. If you'd like to view it later, it will include both the slides and the audio. We'll put a link for the rebroadcast on our website, or you can contact us at Grantmakers and Aging at info@GIAGING, that's GIAGING.org. And just a little promo for our next conversation with GIA webinar, which will be on October 5th. Featuring Mike Yeaton with Empire Health Foundation. This webinar is entitled Measure Something, Evaluation for Everybody, and it will discuss easier ways to get empirical data to be used to improve decision making. Mike will review a simpler yet effective measurement approach for senior health, then have an interactive exercise to practice and build confidence. We're thrilled to be offering this webinar in collaboration with Grantmakers in Health and Empire Health Foundation. So watch your inboxes for registration information. And finally, our age-friendly series will continue in November with a webinar featuring rural transportation. So thanks so much and have a great day. Bye, everybody.